We are talking Medicare 101 today. So again, this is mainly geared towards folks that are starting Medicare the first time, whether that's age 65, coming off of employer coverage. That's part of what we'll talk about today. If you're still working, what that's going to look like for you. Do we have qualified coverage? Do I have to sign up for Medicare? That's always a big question that we have. Hey, this is a lot less money than my current coverage. Do I have to keep my employer coverage? The answer is no. So if it's going to be saving you some money, and we'll talk about that, and what those enrollment deadlines are. Obviously want to avoid any type of late penalties, right? So all of those different avenues. And then if you are over the age of 65, or have some friends that are over age 65, they may be still working to have employer coverage and don't know what happens when they come off of that coverage. This could be beneficial for them as well. So if they're not here today, you can always invite them to the page and they can experience one of these webinars live in the future. And again, we'll have some time for Q&A after. But as you come in, again, let me know where you're coming from. And then in regard to questions and that, you can always put those in the chat during the live stream. And then I will get to those as we can as we go along. And then we'll set some time aside afterward for a few minutes in case any questions pop up. So, and if you weren't able to join live and you're still in the group, these videos, we leave them up here. So you're always welcome to go back and rewatch. There's always good info. Since it's not really scripted, sometimes, you may get something a little bit out of each one different each week. So you're always welcome to join if you need to watch this more than one time or want to join for a couple weeks, no problem at all. So we'll give you guys a couple more minutes here to make sure that whoever wanted to be here, at least live, can do so. Kind of before getting going, I guess I'll give a little intro. Licensed broker here, so I help folks every day through this process, answering questions, how this whole thing works with Medicare, because the government kind of just dumps it on you at age 65 and it creates a lot of confusion. And that's, you're getting all these calls from everybody. You don't know who to answer. You don't know if they actually work for somebody. There's lots of scams out there these days. So that's where we help our clients, is avoid those, understand how Medicare works, how it functions. So that way you're armed with, when you get a phone call, you got a good idea how this process works. So you'll know whether or not you're actually speaking to someone who can help you, or just trying to necessarily sign you up for something. Okay. So, but yeah, licensed broker here. Our main office, we're actually located in Bethel, Ohio. So I like to just let you know that, again, not a call center. And when you call me, you get me. You don't have to dial 3 different options to try and get to me. But we do have a physical location. It's 424 West Plain Street in Bethel, Ohio. That's 45103. So if you wanted to Google us and look us up, you're welcome to do that. But we'll kind of get things started here. Let me go ahead and get my presentation shared here for you guys. Someone just corrected me. I gave the wrong zip code. My apologies, 45106, not 103. That's Batavia, another small city down the road from us. So 45106 for Bethel. At any rate, Medicare 101, we're turning 65, starting Medicare for the first time. So again, we're going to cover the 4 parts of Medicare, talk about what it doesn't cover. When you come onto Medicare, we really only have 2 options. The third option just kind of leaves you unprotected. And if you have other coverages, it's really in one of the other 2 options, whether that's a Medicare Advantage plan or a Medicare Supplement plan. We'll break those down, how they work, and how we compare those for you and what you need to look for. Part D, prescription drug plans. We need to talk about those because that's not actually part of original Medicare. That's one of the components that Medicare does not cover. You need to make sure you have something like that in place so we avoid any type of penalties. If you have Medicaid, there's specific plans designed for you. We can talk about that if that's you specifically. Just call me direct or send me a message. Numbers there, 513-855-6524. So if, again, I kind of highlighted in the beginning, if you missed that, if you're still working, have employer coverage, we want to figure out, is it considered qualified coverage? Because if it is, and it covers your spouse and kids and things like that, you may not actually need to do anything, or you may only want to take a portion of Medicare now and not sign up for Part B yet, because there are specific things that happen when you sign up for Part B that if you don't need Medicare yet, you may not want to sign up for that. So we would just want to make sure we cover that basis for you. And then if you're the only one covered, or if it's super costly, even with your family on your employer insurance, many times you'll find the coverage is better or even less expensive moving to Medicare versus keeping that employer coverage. So help you kind of diagnose and look through all of that. Okay. Again, send me a message, give me a call. Happy to do that for you. So Part A and B of Medicare, you see that red square. The reason I do that is because the federal government offers you Parts A and Part B. That's the only portion that comes from the federal government. The other components that we look to, Part C, that's a Medicare Advantage plan. They break those up into HMOs and PPOs, okay? And then we have Part D, prescription drug coverage, which covers your prescription drugs, kind of self-explanatory there. We'll get through the individual portions. We're going to start off talking about what is original Medicare, what are those parts. Let's have a decent understanding of that, so that way we can understand how we're going to get our coverage, okay? So Part A of Medicare, the way you qualify for this is if you have worked 10 years or longer and paid into Medicare, worked 40 quarters or more is what they call it, then Part A is free to you. Again, comes from the federal government. This part is free to you. Now, it does not mean that anytime you go to the hospital, okay, A is hospital coverage, ambulance takes it to the hospital. Just because it's free doesn't mean it doesn't cost you anything if you go to the hospital, okay? Actually, it can get very costly if all you have is original Medicare. You'll notice here in this chart, we have a breakdown of different co-pays when you go into the hospital. If you have current insurance now, you're probably familiar with annual deductibles and annual maximum out of pocket, okay? A deductible, just to review, is the number that you need to pay before your insurance will typically kick in. And then a maximum out of pocket is typically the maximum risk out of pocket you have for medical expenses on that plan for a particular year. So after you pay that, the plan covers everything else. Well, with original Medicare in Part A, you're responsible for the first $1,600 when you go into the hospital before your insurance kicks in, okay? There is no maximum out of pocket, and your deductible is not annual. It resets every 60 days. So if you go to the hospital for a day or two, then you come back out of the hospital, and 64 days later you go back in, you're going to have another $1,600 deductible to hit, okay? So this next page here kind of lays out the different deductibles and co-pays that you would have been responsible for if all you have is Part A. So in the event, the rarity that you would have a 150-day hospital stay, you could be responsible for up to $61,600 just for Part A, and that's if you only have original Medicare. But again, there's no maximum out of pocket, okay? So have a little bit of an understanding of how Part A is going to work for you. Part B, so just like Part A, you become eligible for this at age 65. Now, Part B does come from the federal government, but it does have a cost to it, okay? So this cost is $164.90 per month, okay? That's what it is for the year 2023. And it has an annual deductible. That annual deductible is $226 this year, okay? So Part A had a 60-day reset for its deductible. Part B is a little bit better because it resets annually, okay? So it's a pretty small deductible. It's only $226. So after you pay that, then Medicare kicks in and pays 80%, and then you're responsible for 20%. Now, this is in regard to doctors, specialists, outpatient type care, things of that, or in the event that you would have a cancer diagnosis. A lot of times chemotherapy medications are going to be charged to your Part B of Medicare, depending on how they're administered. But you would be responsible for that 20%. and there's no maximum out of pocket. Okay. So those are very expensive medications. So if you don't have anything in protection, that could get very, very costly. Okay. So Part A, hospital insurance. Part B, medical insurance in regard to doctor, specialist, outpatient type care. And then in the event of something like medications being administered at a facility, like chemotherapy type drugs, things like that, many times those will get charged to Part B, and you're going to be on the hook for 20% if all you have is original Medicare only and no maximum out of pocket. Okay. So then we got to look at, okay, how do I want to get my care? What options do I have? Well, these are really the two options. If we're going beyond just having original Medicare because we need some protection, and you're already paying $165 a month for Medicare, right? So now option one, you stick with it. The reason why you would stick with it, well, you have the network of Medicare, which is any doctor nationwide that accepts Medicare you can go to, any doctor or hospital, the largest network in the country. Then you have to determine, who do I want to add for my Medicare supplement? Okay. So they come in and take care of the cost that you would have been responsible for if all you had was original Medicare. I'll help explain that a little bit as we get into those specific supplements. And then you want to make sure that you add a prescription drug plan because those are required by Medicare. So that way you avoid any type of late enrollment penalty. Otherwise, you don't have any prescription drug coverage. Now, there are some caveats to that. If you have like VA benefits, TRICARE, some other types of benefits that qualify as drug coverage, you may not necessarily have to have this component. Okay. The other option we got to look to is Medicare Advantage plans. Okay. So what we do in this scenario is now you are electing to take a private insurance company. Okay. That's that Part C we talked about, HMOs and PPOs. You're going to have them become your primary payer. So they take over original Medicare. They have to cover you just as well as Parts A and B. Okay. And then if you need to add drug coverage, okay, then we would have that included already, probably in the Part C that's available. Okay. So, and again, we'll get into specifics on those plans as we go through. All right. Now, again, Medicare supplements, they're supplemental to original Medicare, which would mean that we have to have Parts A and B of Medicare. You will pay an additional premium for your Medigap or Medicare supplement policy. You may have heard that term before, Medigap. They cannot include prescription drug coverage. So that's why you have to add a separate plan. And then the costs are going to vary by company, and they will go up as you get older, whether it's because of your age or because they're going up with inflation or they're going up with the group that is on that plan as a whole. Medical costs get more expensive as we get older. Therefore, the plans are going to increase over time as well. Okay. So that is something else we need to consider. As you come on to Medicare for the first time, or when you're turning 65, the reason it's important about this Part B enrollment is because when you start a 6-month Medicare supplement open enrollment period. Okay. During this time, there are no health questions to qualify. Okay. So if you have cancer, if you have end-stage renal failure, if you've been a smoker for 25 years, if you've had a recent heart attack, stroke, anything like that, you're considered perfectly healthy. There's no health questions to qualify. Okay. So if you have certain medical concerns and costs that you're, concerned with coming on to Medicare, supplement may be a great option for you because it may end up covering a lot of those costs that you would have been responsible for. Okay. Because it's guaranteed the first time we're starting Medicare. Okay. You get your choice of doctors and hospitals, again, because we have the network of Medicare. It's nationwide. All right. So you're not a private insurer. Private insurance company is not confining my network. I get the network of Medicare nationwide. And then coverage is going to be standardized. So the easiest thing about these is comparing them because it's truly an apples to apples comparison where Supplement Plan G versus Supplement Plan G at two different companies, the coverage is the same. What's different is the monthly premium and who the company is that is offering the supplement. So those are factors we need to consider. But as far as the coverage is concerned, it's the same coverage. Okay. The two supplements that we look at right now are Plan G and Plan N. Okay, so if we think back to original Medicare, we were talking about Part A and Part B. Okay, well, Part B, this green box here, we had a deductible of $226. Well, you still have to hit your $226 deductible annually, but after you pay that, your Plan G comes in and covers the 20% that you would have been responsible for, as well as those Part A co-payments and deductibles that you would have had to shell out money for. Okay, so that's the beauty of a supplement, is we're paying a little bit more money, but it lowers that annual deductible to the $226, whatever Part B's deductible is for that year. This year for 23, it's $226. Then it comes in and covers that 20%. Okay, Plan N. Why do we talk about Plan N? Well, a lot of times we're pretty healthy coming onto Medicare, but we want to get a supplement to ensure our future insurability. Well, as we talked about, these plans will go up with time and as we age. Well, Plan N is similar to G, but you could be responsible for a copayment of up to $20 to see a doctor or a specialist, and up to a $50 copayment in the result of an emergency room visit if it doesn't result in an inpatient stay. And you could also be subject to excess charges, which would be if a doctor does not accept Medicare assignment. Not very common, because over 90% of physicians accept Medicare assignment. But if they don't accept it, they could charge up to 15% above what Medicare would charge. So why are we even considering it? Well, one, it's not common for excess charges. And two, in most areas, it's $20 to $30 less per month. Okay, so what that means is if you're not going to see a doctor every single month, you're going to be saving quite a bit of money going to Plan N. And because these plans do go up over time, and again, they're an apples to apples comparison, we can kind of look at the fact that Plan N is going to increase at a slower rate because you have a little bit more responsibility with Plan N than somebody would with Plan G. So if we're pretty healthy and ensuring our future insurability, this is a great way to do that, because not only is it less money today, it's going to increase slower over time than a Plan G would if you're looking the route of a Medicare supplement. Okay. Now we need to talk about those prescription drug plans, right? So prescription drug plans, we need to look at the drug formularies, different tier levels. Okay. Every company is different the way that they cover these prescription medications. They're all going to have an annual deductible, maybe $0. It may be up to, I believe it's $505 this year. And then the benefits run from January 1st through December 31st. So it's important to look at your medications annually. If you've added a costly medication, you need to see how a different drug plan is going to cover that medication, right? So if we've added something that's not non-generic, it may be very important to see how your drug plan is going to cover that, okay? And this is how they break it up into tiers, 1, 2, 3, 4, sometimes up to 5 and 6 tier levels, depending on the company you're looking at. And that just has to do with the way that they rate the prescription medications. Tier 1 on one company may be different than a tier 1 on another versus 4 or 5. Every company, it's their specific medications. You may need prior authorizations before you're able to take a medication, and they may give you a quantity limit. So you may not be able to fill a certain level. Okay, you may be required to only fill to a certain level for depending on what the medication is. And then they also may require step therapy. So this would be like you have a medication that is more costly, and they want you to try a similar medication, but maybe it's a generic version first or a less costly version first before your doctor would deem that, hey, you need to move to, you do have to move to this more costly medication, and then you can get an exception on your plan's formulary, okay? And we have to look at these from a total annual cost perspective. You really can't look at just from a monthly standpoint, because the cheapest drug plan out there may not annually give you the least cost for your medications, okay? So we got to look at what the premium is, what the co-pays for your medications are going to be. You know, when you go to the pharmacy and you pick up a medication, it tells you, you know, all your co-payment is X number of dollars. Well, on a cheap plan, it may be a high number, and on an expensive plan, it may be a low number. So we help you plug all those medications in and see how to compare those depending on which plan is best for you. Okay. Medicare Advantage plans. So that was a lot for supplements. Okay. It's a little bit more of an a la carte, but it's an apples to apples comparison. How do we look at Medicare Advantage plans? Well, we have to look at all aspects. Okay. We have to look at the doctors that you're going to see. Okay. So we look at doctors first. Then we want to look at prescription medications that you're taking if you want us to see what those costs may look like for you, because that can be a really big factor. Because if you really like a company and you really like your doctors, but that particular company doesn't cover your medications well, it may not be a good idea to sign up for that particular plan, because it could end up costing you quite a bit of money just from a prescription medication side. Okay. Then we also want to look at copays. What does it cost me to go see a doctor? What does it cost me to go see a specialist? All of those different factors. Okay. Many of these plans are going to cost $0 per month extra, right? So Medicare Supplement, I have an extra premium on top of Medicare. Many times with an Advantage plan, there's no additional premium. All right. So we're allowing a private insurance company to define our network. So we have to stay within a network, but we're going to get probably a dental, a vision, and a hearing benefit included in that as well. So I don't have to pay for that separate. My prescription drug plan is going to be included in that as well. So you get a lot of extra benefits going this route. You just have to know that you're sacrificing a doctor network to go that direction. Okay. And then you need to know that you're not going to have a monthly payment over and above original Medicare for most areas. There's typically one that's out there. Okay. So it's really, we got to plug everything in to look for your specific situation, because it's really not a one size fits all. And that's where we really key on is for you as an individual. Okay. So when we talk about enrollment dates, already touched on Medicare Supplements. You've got that 6-month enrollment window. You can lock rates in actually 6 months ahead of your birth month, but then you've got 6 months beyond your Part B effective date to lock in coverage guaranteed. Okay. Once you get out of that, you're most likely going to have to medically qualify. So depending on your medical history, if you don't do it on the beginning, you may not be able to ever qualify for a Medicare supplement. Okay. So just things that are key for you. When we talk about enrollment dates in regard to original Medicare, Part D, prescription drug coverage, or Medicare Advantage, these all kind of follow the same timeline. All right. So if you are already collecting Social Security benefits before you're turning 65, you're going to receive your card anywhere from 3 to 5 months. I've been seeing pretty much a 3 to 4 month window right now for folks getting their card ahead of time. The idea behind this is you'll need that card to enroll in a Part D prescription drug plan or a Medicare Advantage plan. So they send it to you ahead of time because you can start locking in that coverage 3 months before the month you turn 65. Unless you're turning 65 on the first of a month, your coverage actually will start the month prior. Okay. But they allow you to sign up to lock in those benefits. It still starts on the first of the month you turn 65, but you can get it in place ahead of time so you're not scrambling at the last minute. Okay. If you are right on the cusp or have missed those dates, as long as you hit either the month you turn or 3 months beyond that, you won't have to worry about a late enrollment penalty. These are key because if you get outside of that window, you may have a lifetime late penalty that doesn't disappear. And that's why it's important to understand when to sign up for those specific coverages. Okay. Annual review. We kind of do this with our clients annually starting in October. You can't enroll in those plans until October 15th. You need to finish everything by December 7th. So just kind of like when you work, there's that annual review for your employer coverage to get everything set up for January 1. Kind of the same concept. Okay. Now this really applies mainly for Part D prescription drug coverage and Medicare Advantage plans. If you're on a supplement, you can actually, if you medically qualify, change anytime you like. But in regard to prescription drug plans and Medicare Advantage plans, that's only during that time. There's specific enrollment dates that you have to follow for that. Okay. So how do you do all this? How do you get through this Medicare maze? You can try to do everything completely on your own. As you know, from what we've gone through already, there's a ton of information, and you've been inundated with info from all different types of people telling you what you have to do. We really focus on you specifically and your individual needs, not necessarily just because somebody else went with it. Okay. So you can try and do all the research on your own, but my recommendation obviously would be going with a licensed broker who can compare all these different carriers that are out there for you, help you navigate through it. Okay. That way you're not trying to figure all this out on your own. Because it's like having to go back to school again almost. All right. And when you work with me, I'm going to give you a non-biased opinion because I work with both supplements and advantage plans, and both carriers can have both. So one insurance company may have a supplement plan and they may also have an advantage plan. Okay. Then I become your advisor on the ground. I become your benefits coordinator. So if you have questions on your plan, you reach out to me and we can help sort through those coverages and what's available to you. I already mentioned help you review that coverage every year. But the key here, there's no cost for my help. Okay. So what I simply do is lay out the options for you specifically and help you kind of see a clear picture of where those holes might be left over from Medicare, and then make sure that we get everything covered that you want. Okay. And it just becomes a much easier process. It's much smoother. It's a lot more stress off of you because you have somebody else that's in this every single day and going to bat for you. Okay. So again, there's our office. Like I said, Bethel, Ohio, 45106 to get corrected on that. But yeah, look us up if you want to. Obviously, you've already made it to our group page. So you found something beneficial here. And yeah, if you are within your window, so the next 6 months to a year, it's not too early to start that conversation of, hey, what do I need to do? Okay. And that's where you can reach out to me directly. There's my contact information. Again, it's 513-855-6524. Okay. And let's have that conversation ahead of time so we're not trying to do these things last minute. Okay. That's the key here, is we don't want to do things last minute. Let's try and get ahead of it, have a good understanding of what our coverage is going to look like. And then from that, it's just much smoother transition for you onto Medicare as well. Okay. So even if you have somebody else that's covered on your employer plan and you're going that direction, we can also look at coverages for getting, a spouse or kids covered, things like that, to make sure somebody's not left uninsured. Okay. That's pretty much the presentation overall for you guys as far as the one-on-one overview. I'm going to keep this open for a bit in case we have some questions popping into the chat. You are welcome, like I said, to pop those questions in, and happy to answer those for you. And or if you want to schedule an appointment directly with me, that number comes right to me. All right. So again, you work directly with me. You don't have to worry about dealing with the call center. Every time you call in, you just get me. Okay. So whether you like it or not, right? So let's see here. Keep this open for a few more minutes here. All right, guys. Well, I'm not seeing anything come through the chat. So thanks again for joining. Like I said, we do these Tuesdays and Thursdays next week. Our schedule is going to be a little different. I've got some in-person meetings that I've got going on. So like I said, I will keep you updated as we do these live webinars, and always feel free to message me directly if you have questions on anything with that. And so thanks again. Reach out if you need help. 513-855-6524. Thanks, guys. Take care.